box first. Okay, I want to welcome everyone to the regular meeting of the Reading City Council for March 17th, 2020. Pam, if you would start, please.
If anyone wishes to address the City Council on any item considered at this meeting before or during Council's consideration of that item, please fill out a blue speaker request form located in the lighted alcoves at the back of the Council chambers and submit it to the City Clerk. The City Council will allocate up to a maximum of 3 minutes per speaker for each agenda item. Staff reports are available online at the City's website or in the public view binder located on the podium at the north side of the chambers. Please silence your cell phones. Thank you.
Thank you, Pam. We will start with the Pledge of Allegiance, and then that will be followed by our invocation from Paul Gans with the Christian Science Church, and please remain standing for the invocation. Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Hello. I'd like to begin with our daily prayer. It is short, succinct, and universal. Thy kingdom come, let the reign of divine truth, life, and love be established in me, and rule out of me all sin. And may thy word enrich the affections of all mankind and govern them. Amen.
Thank you. Roll call, please.
Councilmember DeQuisto is joining us by phone tonight. Councilmember DeQuisto, are you here?
I am.
Thank you. Councilmember Resner?
Present.
Schrader?
Here.
Winter?
Here.
And Mayor McIlvaine.
Here. Thank you. We'll move on to item number 2, presentations. We are going to skip to item 2C, presentation by Brandy Isola, Shasta County Health and Human Services Branch Director, and Dr. Karen Ramstrom, Public Health Officer, to provide an update relative to the coronavirus.
Thank you, Mayor McIlvaine and City Council members. We appreciate the opportunity to speak with you this evening. So I'm Karen Ramstrom, Health Officer with Shasta County, and I'm pleased to be here tonight to give you an update on COVID-19. How do I advance? Excellent. So I'm going to talk today. Just give an overview about what is COVID disease. I'll let you know what our numbers look like, what this current situation is. Also inform you about our response activities at Public Health at the Shasta County Health and Human Services Agency, and talk a little bit about what the strategies are around community mitigation, and really talk about what all of us can be doing to respond to this situation. So human coronavirus is a common virus that causes the common cold. There are about 4 different strains of coronavirus that normally circulate and cause common colds every year. What we worry about with novel coronaviruses, which is what causes COVID-19, is that it's new, so we don't have immunity within our population, and so then that disease can transmit across the population. Other novel coronaviruses that you might recognize the names of are MERS and SARS, and COVID-19 is being called SARS-2, COVID-2, so that's the name. The virus that causes COVID-19 has been, it's how it's been named. So we've learned some from what's happened in China. So out of about 55,000 individuals, these are the most common signs and symptoms. So really fever, cough, it's a respiratory illness. So fever, cough, shortness of breath. Some people have productive cough. Sometimes it's dry. Some people have general fatigue and just not feeling well, kind of achy. So very, very similar to the symptoms of influenza virus. People have asked, well, what about people who don't have signs of infection? Can they pass it on to other people? And we'll talk a little bit about that, but it seems that asymptomatic infection is likely rare, and even if it occurs, it likely is not contributing to transmission in the community. So how is COVID transmitted to people? How do you actually get this infection? So it's a respiratory virus, and so it's transmitted by respiratory droplets. So when a person has symptoms, they cough or sneeze, talk, and those droplets are really small particles that kind of come out from a person's mouth and lungs and to about a 3 to 6 foot area. So not very far, but that's kind of the area where you think about where you could potentially contact a person that might transmit COVID-19 to you. But they have to be generally most infectious when they're having symptoms because of the respiratory droplets. That's how the transmission occurs. The other way is fomite transmission, so coughing into your hand, turning the door handle, someone comes by, turns the door handle soon after you, rubs their nose. That's another way that it can be transmitted, but it's probably more the respiratory droplets and close contact, potentially fomite transmission, close contact of individuals. Usually takes about 5 to 6 days to get sick after being exposed. We don't really know the infectious period, but it's starting to sound it's somewhere around maybe 7 to 10 days, but we're still learning more about that. And how infectious is it? So it's not as infectious as measles. Measles is a virus that transmits much further into the surrounding area and is much more contagious. So every individual with measles in a population that doesn't have immunity, that individual will affect up to 18 individuals. For COVID-19, 2 or 2.5 people will get sick from one person if there are not mediating measures being implemented. So how sick do people get? About 80% of people have mild or moderate illness, so it feels like you're kind of a bad cold. About 14% of people are sick enough to be in the hospital, and about 6% are critically ill. Compared to MERS and SARS, the fatality rate is not as high. We really worried, those infections rolled out in a little bit different way because most of those people ended up in the hospital because they were so sick. So you can identify them, isolate them, contain the spread. Whereas this is an infection that people just go about their daily business, and so that's why it can be transmitted in a community because it doesn't slow us down as much. Also, as far as the numbers, so we are concerned. The numbers went really high in China. They're going really high in some other European countries. But compared to influenza, we have almost 4,000 cases in the United States, but millions of people, 35 to 50 million people are expected to have the influenza this year in the United States. So just in terms of context. Children seem to be less susceptible. Only about 2.4% of cases in China were children up to the age of 19, and they don't seem to get as sick. The people who tend to get sicker with this virus are older adults and people with underlying health conditions like cardiovascular disease, diabetes, if you're immunocompromised because you might have cancer, or on certain medications, and people with lung disease. So what about testing? So this particular test is a PCR test, so it actually looks at the RNA, so it's pretty specific. Came online in late February in the state, and we've been testing since March 6th at our public health lab at Shasta County. The test kits are a little bit hard to explain. People say, well, how many tests can you do? And it's a little bit difficult and to quantify that because our kits, because of the number of controls that are used for each run that we do. But we have a fairly good supply right now. I just learned in the last couple of days that another factor is a piece of the test that you need to do for the initial extraction from the specimen container, and that is something that's used for a variety of different kinds of tests. And because so many people are running these COVID tests, that seems to be in short supply now too. So, but we're working on that. Commercial testing is also available. LabCorp and Quest are up and going. ARUP came on most recently, and we've heard that they were initially overwhelmed, so they're kind of revisiting their procedures, and hopefully will be up and going soon. So who should be tested? So the way to think about who should be tested is somebody who has symptoms that sound like COVID-19 and somebody who has a reason to think they might have been exposed to it. the way that I just described to you. So initially, we really worried, right, about travelers coming from those countries when we didn't have it in the United States, coming from countries that had active transmission. And then as more and more countries have been identified as CDC, there's travel advisories, meaning there's local transmission in those countries. We certainly worry about those countries. And now more communities in the United States, including California, feel like they have transmission going on in the community, meaning that they can't identify what a person got it from, who specifically they got it from. So the priorities in public health at Shasta County Public Health Lab that we're using. So commercial testing is available, so any doctor can order this for their patients when it's appropriate, and it makes sense based on their symptomatology. We really are prioritizing people who are sick or in the hospital, critically ill. If we had an outbreak of influenza-like illness in a congregate setting, like a nursing home, we want to make sure that we have test kits available to be able to rapidly respond in those situations. So what about treatment? So there's no specific treatment available. There are some randomized controlled trials going on right now with an antiviral medication that is being used in certain circumstances, and through these studies, it seems to be effective. So we'll learn more as those randomized controlled trials progress. The vaccine is in development yesterday. So the phase 1 trials, meaning they have a vaccine that's been developed specifically for this virus, and now they're starting to give it to just a few people, about up to 50 or so, and then see if over about a year period of time, if it prevents infection and from a safety perspective, if a person has side effects. So that's where we are with vaccine development. So in terms of actually having a vaccine that all of us can get, it's at least a year out. So how do you treat it? Supportive management, so fluids and symptomatic treatment. For most of us, we would take, whatever we normally take to feel better from a bad cold at home. So whatever that might be, Tylenol, that kind of a thing. Infection control standards have presented problems and challenges in the hospital setting, and those are evolving as we learn more about this virus. So you might have heard about mask shortages, the kind that are fit tested, N95 respirators that healthcare professionals use. And so that's something that we're helping in our county providers as they have a need for those particular kinds of masks. We do have a supply that we're making available to outpatient providers, hospitals, when a need arises. They're doing pretty well right now, as well as emergency medical responders, that kind of a thing. So what does all this information tell us? So this is how I think about it. So this is a virus that's new, so we don't have immunity in our community. About 80% of us are going to have pretty mild to moderate symptoms, so we might just think, in our culture, we're not very good about staying home when we're sick. It's just the way we are, Americans. We just go to work, we just plow through and suck it up and go and pass it and share it with everybody. So, that's why this virus can spread, because we just aren't really good about that. It's just the way that we live our lives. And for right or wrong, it presents challenges with this virus. So, with that in mind, we worry about all of us going around and exposing people who are have underlying health conditions that we might not even know. It's a younger person, but we don't know that they have some underlying health conditions. And older adults, for sure, we worry about them getting exposed. So those are our vulnerable groups that can get critically ill with this virus. So what does that tell us about what we should do? So sick individuals, we want to stay home and avoid contact with others, especially those high-risk groups. And the social distancing recommendations come out of the way I described how this virus is transmitted. And so that's the 6 foot, a space that you hear about, like if you're in meetings and that kind of a thing. That's what that's about. And so that's a strategy that has been proven to be effective in other types of outbreaks. So we'll talk a little bit more about that in a moment. So what do our numbers look like? In California, as of yesterday, 472 cases, 82 travel-related. There have been 98 community acquired, so that's where it looks like that there's transmission in the community. 193 of those 472, though, they're still trying to figure out, was there a person they can identify who they got it from, or they don't know, so it was somewhere in the community, and that's what's really worrisome, and why some of the extreme measures that the governor's been instituting are carrying forward. 11 deaths in California. Shasta County, we've had 1 confirmed case. that individual is healthy, out of isolation at this point, no concern as far as communicability in the community. It was a travel-related exposure. So what's the risk? So WHO declared the COVID-19 as a global pandemic earlier this month. It's a serious public health threat. Like I said, we don't have immunity, and this virus spreads readily in populations. We worry about our healthcare workers because they're caring for all of us every day, and we want to make sure that they have the personal protective equipment, meaning the masks, the eye protection, gowns, and gloves that they need to stay safe while they're taking care of us. And as more and more people get sick, we've been keeping an eye on and having conversations with the hospitals about healthcare capacity, and so that will be continuing to discuss that. So the idea with these containment measures, which I'll explain in a minute, plus community mitigation strategies, is to slow the spread so that we don't have as many people affected, so that we can limit that number that are affected while we're waiting for a vaccine and medications to come along. So what are we doing at Shasta County? So there's a couple key activities that are running in parallel. Disease containment and then these community mitigation strategies. Disease containment involves, so when we have a confirmed case, we had our confirmed case, and we do this with other infectious diseases as well. We isolate that person formally with an isolation order at home, give them instructions on what that involves. They need to stay at home and be in contact with us about how they're doing. And then we also do quarantine orders for individuals who've been exposed. They're not sick, but they've been exposed to this person during a time when we think they might get infected. And so for COVID-19, that quarantine period is 14 days. And so we've done a handful of those orders for related to our case, as well as related to return travelers from some of these other countries that have had community transmission. We're also promoting community mitigation, and that's to protect our population at large, but also our vulnerable groups and our healthcare workforce. We're working really closely with our healthcare partners, doing what we can to try and keep the community informed. I mean, this is a rapidly evolving situation, so that's presented challenges. And, it seems to be an ongoing need to make sure that we're getting good information out there so that people aren't believing misinformation, which has been a concern and has actually been happening in our community. We also are just trying to make sure we have our essential services going forward. We implemented our Department Operations Center a week ago Monday, and this evening at 5 o'clock, I declared a local health emergency, and Sheriff Magrini declared a local emergency in order for us to mitigate any type of administrative barriers or regulatory barriers that would impede our ability to respond swiftly as we're continuing to prepare and respond to this situation. We didn't do that because anything new happened or any other than what we're seeing in the rest of the United States and in California and in the world. So community mitigation measures, so just real quickly, the most important really, and the way I describe disease transmission, hopefully it's a little bit more understandable why we always say these prevention measures that people get tired of hearing: covering your cough, staying home when you're sick, washing your hands, cleaning the surfaces. It really has to do with the way that the disease is actually transmitted and how you actually acquire that infection. Social distancing, we've been working closely with a variety of groups in the community. Businesses, the faith communities, schools, having a lot of conversations about how this applies to their own individual institutions. Isolation and quarantine I described, and then I've mentioned the groups that we're particularly concerned about. So I think everybody's aware the governor is taking this very, very seriously. The areas, particularly in the Bay Area, have been heavily impacted. And that kind of a situation really requires a very swift and serious response. And so on the 11th of March, the governor released the mass gatherings guidance order around limiting gatherings of more than 250 people. And then even for smaller gatherings, we need to make sure that people have a 6-foot space in whatever venue that is. For people who have underlying health conditions or older adults, groups of 10 or less are what's recommended. And then on the 15th, the governor released additional guidance really recommending that individuals over 65 stay at home, just stay close to home, try not to be out where they'd be exposed to people that they're not normally around and that may or may not be healthy that they don't know. And also the same for people with underlying health conditions. There's also information in there about what's recommended for some businesses, bars, nightclubs, wineries. And some of the concern about those, as well as the large venues, is that people at those kinds of events come from a variety of areas, like geographic areas, different communities. So they'll come together, potentially expose each other, and then go back to their own communities, which could be pretty, geographically distant from where the event is, and so that just really promotes community spread. So that's a strategy behind these limiting measures. The governor also, in his order, talked about increasing sheltering for homeless individuals. So that's something that we're actively looking at the county, and just really started having some more serious conversations around that today. And also, we're working really closely with our skilled nursing facilities to make sure that they have the guidance on infection control, what they should be doing about making sure that they don't have visitors come in that are sick and that kind of a thing. And then the last couple of days as well, some federal guidance came out around limiting gatherings of more than 50 that came out from the CDC. And in the last couple of days, yesterday, the president announced these guidelines recommending that people really avoid groups of more than 10 for the next 15 days. So, which is good to see that there's federal and state alignment, and as this disease is really affecting us nationwide. So what can we do to prevent the spread of COVID-19? There are things that all of us, every single one of us, can be doing, and these real simple prevention measures have been shown to really make a difference. So if you're sick, if you have any symptoms, really staying home. The most current guidance around that is like, so say you're sick, you have a bad respiratory infection, and it just feels like you have a bad cold, and you would normally just take care of that on your own at home. That's fine, but doing that so you're at home for at least 7 days and fever-free for at least 3 days before you expose yourself to other people. Do you need a test? Not necessarily. Right now, until we really have much more capacity, we understand people's concerns about that, but as I described earlier, testing is really indicated for people with the right symptoms that sound like COVID-19, and you have a reason to think that you might have been exposed. So if that's the case, then absolutely we want to help facilitate getting you tested. Other prevention measures are really avoiding non-essential travel. I think all of us really need to think about any little outings that we have planned. A lot of venues are going to be closed anyway, which is going to help, I think, with the disease spread. So we're really in a position, we here in Shasta County are really fortunate that we have not been heavily impacted yet. We don't have any signs of local transmission. We've had the one case. It doesn't mean that it's not here and we haven't detected it yet, even though we are doing testing, but we are going to benefit from these, what might seem extreme recommendations in terms of social isolation and keeping people distant from each other where we might be spreading this virus. Also a reminder to use trusted sources of information. Facebook and Nextdoor may or may not be the best place. If you're looking on Facebook, making sure it's a reputable source of the information. So really World Health Organization, CDC, State Public Health Department, California Department of Public Health, Shasta County. We will be working with across partners in the county to come up with a coronavirus website for Shasta County, where we will have information from a variety of healthcare partners and other organizations all in one location. So that's in development. It should be available hopefully soon. I have on here planning for school closures. School closures have come, and Brandy Asola and and she's really led that charge to really try and work really closely with the Shasta County Office of Education and all of the school superintendents and administrators. And it's been a challenge statewide because people are afraid of this virus, and decisions are made that are what they are, and we just have to figure out how to address the impacts, such as daycare, childcare, that kind of a thing, and making sure that kids, if they're not in school, they can still get other services that they might get when they're at school. such as food and that kind of a thing. Employers and organizations really taking extra steps to keep sick people at home, supporting them and encouraging them to stay home if they're sick, addressing barriers to sick leave policies so people feel like they can be at home when they're sick, thinking about ways to have meetings. Maybe you're doing more virtual meetings, smaller meetings that are more spaced out, a lot of environmental cleaning, and just realizing, I mean, this is really causing not only the fear of this virus, but then the challenges with child care and taking care of older parents and that kind of a thing. It's definitely causing worry and anxiety, and rightfully so. And so we just all need to be supportive of each other and recognize that there's a lot of stress, and we're all doing the best we can, and just really need to be supportive during this time. So that's all I have right now, and I'm happy to take questions.
Thank you, Dr. Ramstrom. We really appreciate that update, and it was very thorough. I'll see if the council members have any questions. Councilmember Winter?
I do. Thank you. I've got a few. So thank you, Dr. Armstrong. I appreciate your information. I had a question. I've got actually several here. I want to know if you had done any modeling for our county, just because of our increased risk factors of the elderly. We have 18% of our population are seniors, as opposed to the state average of 12%. We also have higher other comorbidity risk populations with a lot of obesity, heart disease, diabetes, those kinds of things. Those are people more at risk. So, I was just running through some numbers in my head. If 30% of I don't know if you've done that, 30% of the population gets COVID and 20% of those are really ill. I just ran the numbers right here that you're looking at, 1,800 people, seniors could be potentially really, really ill, hitting our ER. So just want to had you guys done any modeling of that locally?
So we've talked to our epidemiology group, and they are looking into that. And I think there's some other efforts to do that, I think at the state level as well, to make those models available, like the tools to do that. We don't have that information yet, but I can say that our hope is that, and we've seen in some of the countries that have been impacted, that implementing some of these mitigation measures do impact those numbers for sure, that these measures, if they're implemented early on and in a widespread manner, like the governor's doing right now, that they can make a difference. So, but the modeling's in the works, but I don't have anything to share with you right now.
And then a couple of follow-up questions to that, and you just spoke to that. How long? I was speaking with a business owner today who's a restaurant owner. So you're out for how long? Are you out? And then what happens when you resume and you're not in social distancing anymore, and someone comes in from another country and brings the virus back again? So how long is this going to last, do you think?
Yeah, it's a good question, and I think we've seen this is continuing to evolve and being pushed out a little bit longer. The last I heard was for the next couple months, and so I think at that point it'll be a matter of looking at the data. Do we have what our figures look like? Are they going up? Are they going down? Are they staying the same? What does it look like in terms of other countries? And I think that there is a lot of effort to limit travel and efforts around educating people around that. My understanding, I've ever heard anecdotally, in the airlines, they really aren't seeing as much air travel. So I think that that's to our benefit. I can tell you that this virus doesn't like warmer weather, and so I'm hoping that will also be to our benefit to slow things down, but it could go into the summer.
Thank you. You mentioned a website where coronavirus information could come together. Will you be on that website, besides health information, will you be providing any information for small business owners who are really going to be impacted by these closures? Will any business type information?
Yeah, it's going to be a countywide collaborative website, so we can certainly take that back and see what we can make available.
Okay, that would be great. Thank you very much.
Sure.
All right, Councilmember Schrader.
Thank you for coming and providing this information. Of the information the questions I had was, what is, in your opinion, do you think is our level of having personal protective equipment available for our health care workers and our first responders.
Yeah, so thank you for that. So we are in regular communication with all of those entities and are taking some resource requests. Right now we're meeting them for face masks. It's been one of our main requests, and making those available. We're fortunate here in Shasta County and some of the other surrounding counties, because of the car fire, we actually got a resupply of masks after the fire. So we have a good number that we can make available over time, and are definitely getting those requests. So the respirators, the masks, we seem to be doing okay. The other thing to know is that as the infection prevention measures that are recommended change over time, also regular surgical masks can be used for certain circumstances. So we do have some supply of that, but we have more respirators. The gowns seem to be a challenge nationwide, actually, having gowns. So right now the recommendations for personal protective equipment for healthcare workers in a healthcare setting are a gown, gloves, eye protection, and mask or respirator. And there's a lot of coordination and regular communication and source polling and coordination with the state health department and in our region with EMS. Our EMS providers seem to be doing pretty well. They have made some resource requests and we've been able to meet them.
Okay. Also, have you decided whether you'll be setting up an emergency operations center on this topic?
So we have had our Department Operations Center at Public Health drawing agency-wide for staffing for over a week now. And we've had conversations with the Office of Emergency Services and are doing coordination as well at the county level. And they're supportive of our work in the DOC. And so that's kind of where we are right now.
Well, I also want to compliment our county in having a state-of-the-art testing facility, lab facility. I think I remember being offered a tour many years ago. And I believe not every county has that available.
You're correct, and we are doing testing for some surrounding counties as well.
I really applaud our county taking the initiative to have our own testing facility.
Thank you.
And I believe you were set up for addressing these types of emergencies through that lab.
You're absolutely right. And I think from our perspective at public health, it really contributes to our disease response. We get results much quicker, and we actually can have information and make decisions about whether it's a case or not and what we need to do with that family or their individual in a much more expeditious way that really does improve our response. So I thank you for that. We're really fortunate.
I have one more question, I think. One about the school closures. Is public health working directly with Shasta County Office of Education and other school and individual schools on how they might be setting up some services, food distribution or things like that? Or is it just the schools that are going to be doing that? Or are you working together with?
So we have worked closely with the schools in terms of the services. So we have heard today that several schools have kind of a pickup food process in place. We also know that a variety of community partners are thinking about where they might be able to contribute. I don't have updated information across the schools of how that's going, but I also know that in the governor's emergency orders that he's included information in there about expectations that schools do their best to try and meet those needs that are not going to be available as kids are not in school. And so I think some of that's coming along. I don't know if you have anything to add, Brandy. Okay.
Well, the other thing is we also, our city manager's office already and communication team already set up a link on our city hub for information on the coronavirus.
Great.
So, and with the idea that we were and also providing links to other information. So I'm sure that we can work together like we did with the car fire on how we can jointly communicate, be on the same page. We really appreciate your efforts. Thank you for coming.
Thank you. That sounds really good. Thanks.
Okay, did Councilmember DeQuisto have a question?
Yes, I do. Thank you very much. I have three questions. The first one is the county considering more restrictive measures to try and keep the numbers as low as they are right now?
So it's a good question. So as I said, we're fortunate to be where we are, and I think we are going to benefit from the measures that have come out from statewide from the governor. We are supportive of the governor's recommendations in terms of community mitigation strategies. Some of those more county-specific recommendations are really being are more necessary in communities that are heavily impacted in the Bay Area, and that would not be recommended at this point in our community, but certainly the limiting mass gatherings, just trying to be more conscientious for the time being around being around larger groups, making sure that we are distancing ourselves, and we're supportive of the measures that actually are in that spirit of trying to keep all of us a little bit distant from each other physically for a while.
Thank you. The second question is, given that you could go 14 days and be asymptomatic, but you go back out in the public, and if it's not under control, you could catch it again, are you suggesting that some of these measures would be almost permanent lifestyle changes that we should try to incorporate?
So during the annual, respiratory season, many of these measures are really prudent in terms of like staying home when you're sick and staying away from people who are exhibiting symptoms of respiratory illness. So during that time of year, even, the environmental cleaning. So some of these are things that we recommend every year during flu season. As far as the more extreme measures, I think we're going to get to a point where, we're lucky that a vaccine's in development. I'm looking forward to having that vaccine available. I think we would highly recommend that our community members get that when it is available. And then once we have enough immunity in our population, then there will be some barrier to this transmitting like it is right now. It's transmitting very much more widely right now because we don't have that immunity.
Thank you. And the last question is there anything specifically the city can do to help that we're not already doing? And if there is, could you make the recommendation or recommendation?
That's wonderful. Thank you for that. I think that we have been communicating to some degree, and I will take that back and definitely keep it in mind. Thank you.
Okay, Councilmember Vice Mayor Resner.
You said you gave us the California numbers and that we had one positive test here in Shasta County, and that gentleman has since recovered. Do we have did you give any numbers that I missed of folks that we have that we've asked to self-quarantine because maybe they didn't reach the level of needing to be tested?
So we did quarantine orders, and when the initial travel recommendations came down, when China was initially pretty much was the main country that we were concerned about, and that evolved over time. CDC had different recommendations for different countries and different amounts of exposure that we implemented based on those guidelines. Some of those, if there was lower risk but not no risk, those were the ones where we had people self-quarantine, but we also had others that we were doing active monitoring on return travelers. And all of those, early on, we did for the 14-day period and had contact with those individuals twice a day on monitoring symptoms and that kind of a thing. Right now, so it's a little hard to give you an exact number because it's changed over time if people have come in and fallen off that. Right now, I think we have about 6 or 7 individuals that we are monitoring and on home quarantine that we're in close contact with.
Awesome, thank you.
Uh-huh.
Okay, I had one final question. Will there be a point in time where there will be voluntary testing available for people that may think that they have the virus and can get tested, say in the drive-through testing environment, just to ease some of the fears and panic so people know that they test negative?
So it's a good question. So we are doing some planning right now with some community partners in the healthcare arena around the need and to determine what the need is and to determine what a strategy might be to make that happen. Right now, if a person has symptoms, I mean, they can go to their doctor if they feel like they have some reason that they feel like they might have been exposed. They can go to their doctor, even if it's mild illness, to get tested. We have heard from some people, I mean, the healthcare offices are overwhelmed even this time of year baseline, just from respiratory illness, even before coronavirus, so that does present challenges. So we're working on that. It's a little bit also challenging because of many components related to testing. So for example, the viral transport media that you actually put the swab in, that you collect the specimen, is hard to come by right now. So right now we're strategizing nationwide. We're all strategizing on, you can actually split that and use that in 2 vials. You can actually potentially make your own viral transport media. You can maybe use saline. So there's a lot of components to the testing. The swabs, so some partners have enough of the specific kind of swab you need. We're on low supply right now, so we're communicating about that. The part of the testing process that doesn't have to do with the kits, it's just part of actually doing lab testing, that is in low supply now, but it has to do with the particular machine that lab has. So it's quite involved in terms of figuring out capacity. So if we're having that, then all those commercial labs, they're also working on that too, because they need the same viral transport media that we do. So all of that, I think, is being addressed nationwide, but testing is available. Commercial labs are testing. The regulations were updated just in the last week to make sure that any of those positive results get reported to public health immediately, so we can follow up on those. But we do recognize the need for some individuals who might not have a doctor where they can readily go, and they have some real reason to be worried. And so that's what we're working with some healthcare partners to figure out, can we actually, develop some sort of a drive-through option or a site where people can go. So we're actively discussing that right now, and it's a priority, and are hoping to do that sooner than later.
Thank you. Well, again, we really appreciate you coming tonight to make this presentation to us. It's very important. Were there any final questions from the council? All right. Thank you, Doctor.
Thank you for the opportunity. Mm-hmm.
Okay, moving on. The other presentations for the night have been postponed, so we'll move on to item number 3, public comment.
Pursuant to the Brown Act, City Council cannot take action on public comment items. The City Council will allocate up to a maximum of 3 minutes per speaker for 30 minutes total at the beginning of the meeting for public comment for non-agendized matters within the city's jurisdiction. The mayor will determine the order of the speakers. If 30 minutes is not adequate to accommodate all of the individuals who have submitted a speaker request form to the city clerk, the council will trail this item to the end of the open session agenda. The remaining speakers will address the city council at that time.
Thank you. We do have a couple speaker request cards. We will start with Mr. Marcus Lega, followed by Mr. Stephen Peloza, followed by Mr. Douglas Leganor. Up there at the podium, sir.
First off, Mr. Mayor and Council, thank you for your service. It's needed. I'm here to speak in behalf of these people over here that are helping the homeless. I'm a Marine vet. I serve my country. And why am I homeless? It's not right for veterans unless it's by choice. Okay, that's different. But by circumstance, I've had 5 strokes, more reconstructive surgeries you can shake a stick at, where I got shot when I was in lung. But no veteran should be homeless. We served our country. Why can't our country serve us? A little bit. And y'all do a lot. Y'all do, and that's why I tip my cover and say thank you. Because without y'all, ain't no us. Y'all run this city, and they help when they can, and I appreciate it. This man here, he's got property and he's got tents, I mean, he's helping homeless, not just vets, but homeless. And it's a sad state of affairs, it is. Like I said, allow me to reiterate, if it's by circumstance, not by choice. Again, I tip my cover and thank you all for your service, and thank all of y'all for being y'all. Because you know something? You're special and you count real quick. You know why? Because without y'all, there ain't no us. That makes you special, and that makes you count. That's what I searched for, and that's what I served for.
Thank you, Mr. Lega. Next is Mr. Pelosa, followed by Mr. Leganor, followed by Miss Stacy Baxter.
Okay, ladies and gentlemen of the Ready City Council.
If we could get you to speak into the microphone.
Yes, sir.
Thank you.
Boy, might as well stand on this. Ladies and gentlemen of the Reading City Council, my name is Stephen Pelosa, representing the Paul Bunyan Conservation Society, which my mother Wilma and I founded right after 9/11. Our mission statement is to improve the environment. I stand here before you with a broken heart. Our society is in a downward spiral with no bottom in sight. Now we have the virus pandemic wreaking havoc on the world. We believe that founding the Paul Bunyan People's Army would be the solution to all social ills. America was founded on a dream of land of the free and home of the brave. In the spirit of our greatest American folk hero, Paul Bunyan, we can start a movement that would put America back on the track to be the shining beacon of the world. People need a cause to fight for. In the words of President Kennedy, it's not what your country can do for you, it's what you can do for your country. He died for his country, and I will too. It comes down to that. As a Reading City Council member, you signed up to fix the big problems. They don't get any bigger. That's my big problem. I think so big that my program is viewed as radical. I'm a patriot of my great country, and I hope you are too. This body of elected officials can spearhead this great crusade. We can found a task force charged with coming up with the solution. Paul Bunyan's People's Army does that. We clean up our forest and utilize this great resource. Basic shelter is number one. The homeless crisis is the unbelievable disaster that we have. You know, how can anybody sleep with this going on? For the homeless person, every day is a struggle for life or death. I dream of a much better world, which everybody does. What's your solution? You sign up to be a leader, it's time to stand up and do your duty. Help found Shasta County, Paul Bunyan's People's Army, declare a city emergency, and we can get to work. God bless you, and we got to do something. And you know, society is. What kind of America do we have that people are dying on the street and the crime and everything else? But you know, I know it's a pipe dream I got, but that's where it starts. Is it, you know, American? So this is a symbol of World Peace Birdhouse. I'm sure you guys have all seen me around with these, and you know, I suffer from poor organizational skills to try to get this going. So,
All right, thank you, Mr. Pelosa. We appreciate it.
okay.
Next is Mr. Leganor, followed by Ms. Baxter.
Hello, my name's Douglas Leganauer. I was homeless too, and this man was nice.
Sir, if we could get you to speak into the microphone. Thank you.
My name's Douglas Leganauer, and I was homeless out on the street too, and this man come forward and helped me out. And since then, I've joined his army. I've straightened up, and my hygiene's, you know, went through the roof even, and he's been tremendous. He took me into his home, you know. I'm pretty emotional, but he's a pretty good guy. He shares a lot of my interests. He's got a good heart. He helps people. He gave me a chance, you know, when nobody else would. I don't know more I can say, you know, he's just all around good guy. I'm still getting to know him. So I love what he does, the environment, and I don't know why more people just don't see his dream more clearly. And I could say more, you know, I'm just kind of shy, and never stood in front of an audience for a long time, and but yeah, they all said pretty much everything, you know, that needs to be said, but I needed to be heard, so thank you. I appreciate you guys.
Thank you, Mr. Leganor. Miss Stacy Baxter.
I'm Stacy Baxter. I'm a local realtor. I wasn't prepared to speak tonight. Thank you for your presentation today on COVID-19, and where we get our information is so important. I got a message today that City Council was voting on sheltering in place. I'm so glad that's not true. So I rushed here because I wanted to have a voice about that. We all realize how important it is to blunt the curve, and I think we're all taking all the measures we're being told to do. We're doing social distancing and hand washing and lots of hand sanitizing to try to prevent any spread. So if hopefully we don't get to the position that we're seeing the virus spread in other areas, I would just implore you, I know that the city leaders look to you to make decisions about the health and the safety of our citizens. We know that we need to blunt the curve, and we know that the most vulnerable, people who have underlying health conditions and people who are elderly, are where the hospitals are getting really impacted in the other areas because of their poor health. So I just hope that if there was ever a shelter-in-place order, that would be limited to those most vulnerable, where we're seeing the impact, because I do think that the rest of us healthy people are able to do our work. A lot of us are able to do our work without causing any spread. Thank you.
Thank you, Ms. Baxter. Okay, we'll move on to item number 4, the consent calendar. And Pam.
The consent calendar contains items considered routinely and/or which have been individually scrutinized by City Council members and are anticipated to require no further deliberation. If a member of the public wishes to address an item on the consent calendar, please fill out a speaker request form and submit it to the city clerk before the consent calendar is considered. It shall be the prerogative of any council member before the consent calendar is acted upon to 1, comment on an item, 2, respond to any public comment on an item, 3, request the record reflect an abstention or nay vote on an item, or 4, remove an item and place it on the regular portion of the agenda for delivery of a staff report and/or an extended discussion or deliberation.
Thank you. And did we have a question from Councilmember DeQuisto? Yes, Michael, you're up.
Yes, thank you. On item 411F, I want to reflect I'll be voting no. I think that purchasing smart parking meters may be a good idea, but the timing is bad, and I think there are other activities that the police can use their limited resources on, so I'll be voting no on that. Otherwise, I'll have a yes vote on the balance of the calendar.
Thank you. Councilmember Schrader.
I just wanted to bring to our attention 4.4a, and this might not get a lot of attention, but it's the annual flood management plan evaluation report. And based on the calculation that was provided in our report, we're saving each homeowner who has a policy about $160, over $160 a year. And I just want to bring that to people's attention, that because our efforts at maintaining the proper planning by our staff, we're able to have a reduced or a class rating that gives our customers, clients or customers who have the flood insurance, a 20% reduction, and that equates to about $160 a year for those homeowners who have flood insurance.
All right, thank you very much.
And I can make a motion to approve the consent calendar.
I'll second.
Okay, any other questions? I will be voting no on item 4.11 to stay consistent with my previous position. 411J, I'm sorry. Okay, we have a motion and a second. All those in favor say aye.
Aye.
Any opposed? Oh, we need to do the roll call vote. I'm sorry. Okay, so with the 2 no votes,
So on item number 411G,
it was 411.
411F,
Yes.
that member DeQuisto is voting no. Is the balance of the council voting yes on that?
Yes.
Okay, so that would be a 4-1. And then on item number 411J, that council member McIlvain is voting no. Are the other 4 council members voting yes?
Yes.
Yes.
Thank you. So now for all of the other items on the consent calendar. Councilmember DeQuisto,
Aye.
Resner,
Aye.
Schrader,
Aye.
Winter,
Aye.
and Mayor McIlvain.
Aye.
Thank you.
Thank you. So the consent calendar passes. We'll move on to item 9, our regular calendar, 9.4B, Development Services. Consider report regarding zoning issues surrounding micro shelters. Director Voppel.
Thank you, Honorable Mayor and members of City Council. Tonight, this is a follow-up report based upon Council's direction a couple months ago to have staff research the use of microshelters to help with the homelessness issue and report back to City Council. And so tonight, the report will begin by defining what a microshelter is, explain how other communities are utilizing them to deal with homelessness issues, the current treatment of our zoning ordinance towards microshelters, and then recommend a process by which the council could allow for the use of micro-shelters here in the city of Reading. So first, what do I refer to when I talk about micro-shelter? Micro-shelters are basically shelters that do not meet the criteria of the California Residential Code. So these are considered non-structures from a building permit standpoint. And that's because they don't meet many of the codes, and because of the construction type, it's really impossible to meet certain aspects. For example, residential fire sprinklers and the green energy code and solar and being net zero and the snow load and seismic requirements, mechanical, electrical, plumbing, etc. Okay, so these are not typical buildings, all right? Examples of these would be tiny homes, recreational vehicles, tents, Conestoga huts, plant manufactured units, so manufactured housing, et cetera. And so here's a couple pictures of what I'm referring to. So you can see a tiny home. It's built, typically these are built to the RV standards, tiny homes, and so they're on wheels. They're basically treated just like an RV. And the Conestoga hut is about a 60 to 80 square foot single occupant type of micro shelter that is being used in communities as well. So the issues that we have with these in relation to the current zoning code is essentially if you're living in one of those, you're camping under our ordinance. And where can you camp? You can camp in RV parks, and that's about it. And so our zoning ordinance, didn't anticipate these being the primary use on a piece of property. And so that's the issue. So when people have said, well, I want to build a community of these, really there's no way to make that happen right now. So what are micro-shelter supportive communities? So because you can see these are pretty low cost to build, right? Where you're not talking about building a dormitory or some sort of major structure or building. And they can be built in a matter of hours. Many communities are utilizing these as living quarters for supportive communities to take homeless individuals out of the parks, out of the street, out of the open spaces, shelter them in these while they get the support services that they need. Typically, they're operated by nonprofits and community health experts. It's similar to a homeless shelter in that you're inviting in homeless individuals, but they have a bit more privacy. There's more. They can lock up their their packs and their bikes and all their belongings in this shelter. It's a place to call home for them, and it adds some stability to their life. Typically, these communities are operated on a much smaller scale than a typical homeless shelter. So typically it's 5 to 10 individuals or units, these micro shelters in a gated type of community. Again, they're typically homeless individuals who are currently unsheltered. The supportive services include health care, mental health, the job training, clothing, food, shelter, showers, restroom facilities, shared kitchen. Typically, they'll have a community garden. They typically have to work and be a part of that community in maintaining the community. We do have a couple examples in California. Here's one called Innovative Bridge in San Jose. They're using tiny homes and to shelter homeless individuals. You can see they have a community garden, small, little 80 square foot units. There's also several up in Oregon. This one that I have a site plan showing you is called Opportunity Village, and you can see they've created a little village with a shared kitchen in the middle, a common area where they can gather around a fire pit, bike storage, restrooms, laundry facilities, gardens, etc. So I presented in the staff report a couple options for the council where I think we could work with stakeholders and the Planning Commission and talk about a way that our zoning ordinance could address these in a way that deals with the impacts that they might have to a neighborhood, but also allow them in the community for those wanting to try these as a way to address the homelessness issues. One way would be to simply add some provisions under the shelter for the homeless section of the zoning code, which was attached to my staff report. Another way to do that is create a new land use category specific to micro-shelter supportive communities that could have less restrictive requirements than those of a homeless shelter. Since these are operated on a much smaller scale, maybe the impacts are different. For example, the homeless shelters, they can only be in the heavy commercial zoning district. That's it. That's the only place. You have to get a use permit. You have to be X amount of distance from a residential district, from a school, and all of those things. Whereas as these may not have those big impacts on a neighborhood, so maybe they could be allowed with a use permit elsewhere, like on public facilities, zoned land, or in association or ancillary to a church, things like that. And so, we need to address those types of issues that we want to make sure that would be part of their operations plan to make sure there are no negative impacts or spillovers into the neighborhoods. Things such as, where are these going to be located? Where's the right and proper place for these? What's the maximum number of these? The restroom and shower and kitchen, how are those needs going to be addressed and met? Security, how long can they stay? Typically, these are transitional housing units, and so they're used for 6 to 9 months while they get the skills they need to then move into permanent housing. What kind of supportive services, and of course lots of neighborhood input, notice and input into the process, into the approval process of these. So our recommendation to you is that you ask staff to work with the Planning Commission and the community stakeholders to craft some amendments to the zoning ordinance that would allow micro-shelter supportive communities, and then we'd come back to you after we go through Planning Commission with that recommendation. Happy to answer any questions.
Thank you, Director Voppel. It looks like we do have some questions. Councilmember Schrader.
Thank you, Director Voppel. I appreciate your taking the time to craft some ideas and do some research and provide us the information. And I think all the council members will be directed to information that we receive from a community member on, examples of what they've been doing for the last 5 years in Eugene. I'm very supportive of recommending that we have you work with stakeholders and the Planning Commission. In particular, I'm more in favor of the second to last paragraph on page 2, which is the second option, or the second of two options, which is to create a new land use category. I think that gives the city some flexibility. Also would allow for accountability and probably fit better. Have some give us more opportunities, but with the right accountability with the use of requirement of use permits. So that's, thank you.
Was that a motion?
Sure.
Okay.
Do we have public comment? I actually had some questions.
No, I
We
don't
do
think so.
not have
Oh,
any.
we have- okay.
We do not have any cards, but Councilmember Schrader, were you incorporating something other than what's written in the recommendation? And could you, if so, could you let me know what that is?
Sure. My recommendation is to authorize staff to work with the Planning Commission and community stakeholders to create a new land use category to allow supportive micro-shelter communities. So I kind of just rework the wording to incorporate the language that Director Voppel had in one of his PowerPoint.
Would you allow heavy commercial as well? Like it could be both?
Oh, I'm not saying that they shouldn't be. I'm saying heavy commercial is fine.
Okay.
But I think this option gives our department greater flexibility, or gives the community more flexibility. It's not I'm not saying, I'm not.
You're saying both.
Yeah, I'm not
Both. Okay.
excluding
That was my
the
question.
current likely placement. I'm just looking for ways to have a little more flexibility.
Okay, thank you, Councilmember
Yeah,
Winter.
so just before I second that, I just wanted to just ask some questions and clarify. I'm grateful that we are looking at the flexibility with this. Just a few things I wanted to ask: is this going to be site specific? My concern is because in the report there was a limited, looked like a number up to 24 individuals, and I would be concerned in some neighborhoods that might be too many. So are you going to look at each site specific and get, what if the neighbors around there are protesting? Sometimes churches can be in little neighborhoods with lots of housing around. So I'm just wondering how you're going to address that.
Sure. The ordinance that is attached is our existing ordinance relating to shelter for the homeless. Because I referenced it in my staff report, I just attached it for reference. It isn't by any means any sort of like template as to how we would also regulate these. So that's one of the issues that would need to be addressed in the language that we would come back to you with, is what is the appropriate amount, and maybe there's a maximum, and that's it. And then everyone's a use permit, and they come in, and based upon where it's located and how many they can support with restroom facilities and kitchen and everything else, all those factors are going to weigh in. So I wouldn't put a specific number, I don't think. After speaking with Planning Commission and stakeholders, we want to be flexible, I would think.
Okay. And we're looking at transitional housing. This is not permanent, so temporary and qualified shelter providers for all of the wraparound services.
Right. So requiring an operational plan and a use permit is how you get to those type of requirements, to make sure that it isn't just, for instance, a low barrier shelter with nothing else. That if with that use permit, with that operations plan, you can make sure it's going to be providing the services that you want it to provide. So that's the direction we would head, I think.
And would there be teeth in that? Let me just ask, I'm assuming that would be the case if for some reason that provider was not fulfilling their operational plan. Would there be a way to withdraw that permit?
Absolutely.
Okay. Thank you. I will second Councilmember Schrader's motion.
Vice Mayor Resner.
I have a question for Councilmember Schrader. Were you, as I'm reading this up here, direct staff to work from the Planning Commission and community stakeholders to recommend amendments, are you saying rather than amendments, like creating a full different category, could we potentially say give it to the Planning Commission and to stakeholders to create amendments and or categories to the zoning ordinances? I just don't want to pigeonhole them into one thing if the stakeholders and Planning Commission come back with a different sort of recommendation. Does that make sense? I'd like to sort of let them be creative.
I worry that if you look at I'm open to it, but I'm just saying that there was a lot of changes that would need to be addressed, that would address some of the things that Councilmember Winter just brought up, that I think the preferred direction for me is to create a new planning, a new zoning. I mean, it can incorporate some of the things we already have. That would be my preference, because I think you can address the issues that a lot of people will have concerns about better by having a new one rather than reworking the old one. So my preference is to go with the new one, or a new planning, what are we calling it? A new land use category. I think we can accomplish it better by doing a new land use category.
Could we ask Director Voppel to weigh in on that?
Could you weigh in and ask and offer to us what gives you the greatest flexibility to come back with the strongest recommendation?
The staff recommendation. So, I put those options in there just so you could understand kind of what we may come back with. It was two options that were top of mind, but stakeholders and Planning Commission may have a whole new set of ideas, right? And so with that staff recommendation, it may or may not be a new land use category, but it gives us the most flexibility because it just has amendments. That could be anything. That could be creating the new one, or it could just be amending the existing one.
So I'm willing to change my motion to say, to identify the language that Vice Mayor Resner just talked about, identify amendments or a new zoning category.
Yes.
I will approve that as a second.
Okay. Were there any questions from Councilmember DeQuisto?
No.
Okay.
I just want to, we've had some problems with motions recently. So, I mean, essentially, if I could take a stab at wording that, the motion is essentially staff's recommendation with a preference with new land classifications as opposed to amending existing ordinance.
Okay, no, actually, no, I changed that to say,
Staff
to
recommendation.
take out the word preference and just say, authorize staff to work with planning commission and stakeholders to,
But I mean, I guess my
I'm
comment is
wor-
that staff recommendation gives maximum flexibility to the planning commission and the stakeholders to bring back an item to the council. If the council wants to actually narrow that focus, then that would be important to know. If you're trying to maximize the opportunities for all the stakeholders in the planning commission, then that's staff recommendation as written in the staff report.
Okay, well, I don't want to be too detailed. I mean, argue about this, but to me, when I read that, it says, no, you're going to just fix the old one. And
No,
I think
the clarification is that amendment to the zoning ordinance is the entire zoning ordinance. That's not, as Mr. Voppel just said, that could be amending a section that's already there, or it could be creating an entire new section. Both of those are considered amendments to that ordinance.
okay, so that's what I prefer, and I just wanted to have some language that made that a little more clear than when I read this. This looks to me like all we're going to do is just stick with the old one and make a few tweaks.
Yeah, this provides the allowance for an entire new one, so
Okay.
perhaps you could say that staff recommendation with a preference towards a new section as opposed to amending existing sections.
I would personally prefer to give staff the most flexibility.
No, I'm fine with taking the word preference out but I just want it to be clear in the recommendation that we agree to that we're not just talking about just fixing the old one.
So for the record,
I think that's
the
clear,
staff
yeah.
recommendation clearly allows for
Okay.
a complete new section write-up, as I think
Okay.
you're preferring. And so staff recommendation would give us the maximum flexibility, plus it certainly provides very direct direction for staff relative to the motion.
Would you be willing to amend your motion to this staff's recommendation?
I think she did.
Okay.
Pardon? What?
I was going to say, I think that you did. You amended it.
I think it would be good for that to be specific as the mayor's requesting.
Oh, sorry.
So if you want me, so what?
So
we're
just
doing-
if your motion is amended to staff's recommendation.
That's fine.
And
I will second that.
Okay.
thank you.
All right. We have a motion and a second. All those in. We'll take a roll call vote. Sorry.
Councilmember DeQuisto,
Aye.
Resner,
Aye.
Schrader,
Aye.
Winter,
Aye.
and Mayor McIlvain.
Aye. Thank you. That motion carries. Moving on to item 9.5A, electric utility. Consider Reading Electric Utilities report regarding North American Electric Reliabilities Corporation's regulations that change RU's registration status. Director Beans. Thank you.
Good evening, Mayor McIlvain and council. So this is a very exciting topic. I gave you a handout too so you can follow along. So this conversation is a benefit of the Energy Policy Act of 2005 signed by George W. Bush. And one aspect of that act was to increase the electricity reliability and infrastructure. How do I change this mouse? Okay, oops. Okay, how do I get rid of that? Exit. Okay, thanks. All right. So, just 3 quick acronyms, and I have a picture on the next slide that'll help you see what those are. So the regulating authorities under Congress is FERC, Federal Energy Regulatory Commission, and they have the authority to oversee the reliability of the bulk power system. And they delegate their reliability portion to the North American Electric Reliability Corp, called NERC. And so NERC has developed and enforces reliability standards. And then the NERC, it covers the entire nation, and then it's broken up into 6 regions. And the region that we are in is the WEC, the Western Electricity Coordinating Council. Here you see a map. We're in the green WEC. You see Texas has their own rules over there. So the bulk power system are facilities and control systems necessary for operating an interconnected electric energy transmission network. So the western grid is connected from Canada through the western states all the way down to Mexico, and Reading is part of that. And the bulk electric system is further defined as all transmission elements operated over 100,000 volts. And it turns out we have 71 miles of 115,000 volt lines that connects us directly to WAPA, the Western Area Power Administration. And those transmission lines feed our substations that then transform the power to a lower voltage, puts it around the city, eventually to your home. So those assets, those transmission lines, and substations and breakers that operate them are bulk electric system. So because of that, through NERC, anybody who has a system like that is responsible for it. They have to register at various levels. We're already registered as a generator owner and operator for our power plant. We're also registered as a distribution provider and a resource planner. And once you're actually recognized at a higher level, like a transmission owner, transmission operator, which is what we're talking about today, that starts adding on more standards, and I'll show you the changes that are coming up. Some of the important things to know about these increased regulations and standards that we have no way of avoiding are, if you have a violation on one of the standards, the penalty per day can be over $1.2 million. So they have real teeth, and entities are actually fined, not always to that level, but this is real money. This is a real issue. We have to do this work. So in 2012, actually, we had our first audit, and WEC came out here and went through our standards, and we did a great job with how we were registered. And they did notice that we had 115,000 volt lines, and they said at the time, "We think you're fine. We don't think you need to register as a transmission owner operator." We said, "Great." So we kept avoiding that. And then in 2018, as the world keeps changing, they came back to us and said, on second thought, you need to register, but if you don't want to, or if you think you still don't apply, or it doesn't apply to you, then why don't you go through the process of trying to be exempted? And so to do that, we went through this whole process of developing documents. We worked with our balancing authority. We worked with WAPA, who we're directly connected with. We worked with the California Independent System Operator. We worked with WEC. And we developed, we thought, a very good case that NERC could look at and say, yeah, Reading, you guys do have these big lines, these 115,000 volt lines, but you're a small utility, you're connected to WAPA, you're embedded in their system, you're fine. Well, we turned that in September last year, and in February they said, no, you're not exempt. So once that happens, a clock starts ticking. And so right now we're on a 90-day clock, and by May, we are going to have to register as a transmission owner. And once we do that, then we'll have to register as a transmission operator, but that first initial registration for a transmission owner, we have to actually submit a plan that can go out as long as 24 months with 3-month increments on how we're going to reach compliance. And so there's a lot of work to do. Some of the things that NERC said in their decision about why we should register is they say we do have a material impact on the BES. So basically, you know, Reading is a big enough system. It has the assets that can actually, if we did something wrong, we could, you know, cause other people to lose power. So right now, we're a generator owner, operator, distribution provider, resource planner, like I said. In the future, we're gonna have to be a transmission owner, transmission operator, transmission planner, possibly. The balancing area, or balancing authority is unlikely. I think that's mostly confusion on NERC's part. We should be able to get out of that. That would put us on par with the California Independent System Operator, and I just don't see us there. We currently have 100 reliability requirements we're responsible for. So we have staff that works on those, and these aren't just check the box things. These are things that you have to actually do. We have engineers that have to do testing on relays. They have to not only test it, they have to have a plan to test it. They not only have to have a plan, they have to prove they did it. And then they not only have to do that, they have to keep all their information and turn it over when they ask for it to prove we did it. So coming up, we're looking at another 140 requirements. And as I said, those are gonna be more intense. A lot of them are cybersecurity related. So we're gonna have to look at some major restructuring and investments. Right now, our audit cycle, like I mentioned, was a 6-year off-site. And actually, since 2012, we haven't had an audit. It's been almost 8 years. The new, once we're registered as a transmission owner, it'll be every 3 years, and they're gonna come here, rifle our drawers, talk to our people, and it's gonna be, you know, serious business. So as I said, May 12th, around there, we're gonna submit our plan, and then eventually register as a transmission operator, and then we'll work on the BA stuff. Anyway, I just want to give you a heads up. No action needed tonight, but this is going to impact our operations. It's going to increase our costs. Just a really rough guess, it could easily be $1 to $2 million per year ongoing, maybe more. It's hard to say. So I'll take any questions.
Thank you, Director Beans. Were there any questions from the council at this
That
time?
was my question, that last one. So, and when will you know that? Let me just ask that. When will you know the cost?
We will have a better estimate as we get closer to the May date, as we have our plan. And so we'll be bringing forth organizational changes, some software changes, but some of this we won't know fully until we start bidding out software, and then the next level of transmission operator. It's going to incrementally grow. So there'll be some upfront we'll know, and then there'll be some incremental that'll keep happening.
Thank you. Did you have a question, Councilmember Schrader?
I just want to, I think Director Beans was way too modest when he cavalierly just said, well, in 2012, WEC suggested it, and they said that it was okay. It was way more than that. There was a significant amount of staff work that went into that, not only that year in 2012, but subsequent years. And if you take the average, about $1.5 million a year, really REU staff independently saved about $12 million over that period of time just by their quality work, working with our partners and working with the WEC. And so I think he really underplayed that, but I think recognizing Dan and his staff for that is necessary.
Thank you. Councilmember Schrader.
Well, I just want to add that, and to remind everybody that this was not included in the budget that we adopted for REU for this calendar year, when, you know, we will potentially have expenditures to that amount or the next year. That was not in either of these 2-year budgets. This 2-year budget, this projected $1.5 to $2 million cost per year. So we're talking about $3 to $4 million in this 2-year budget cycle, potentially.
Correct.
So does that mean that you will be coming back for budget adjustments then?
Yeah, mid-year, I think we could probably handle it.
Yeah, the likelihood, depending on what the plan and the need is, it could be earlier than that. We could come forward with a request for both an appropriation of funding as well as staffing. That could come as early as May. As Director Beans stated, in terms of the cybersecurity, we're working on what that looks like, not only within REU, but how that affects the entire organization within informational technology as well. And we definitely want to get a jump, if you will, on the cybersecurity elements, because those could be some of the most difficult to obtain, as well as put us at the most risk.
Thank you. Were there any questions from Councilmember DeQuisto? All right.
I'll make a motion that we accept the report.
I'll second.
Okay. We could have a roll call vote.
Councilmember DeQuisto,
Aye.
Resner,
Aye.
Schrader,
Aye.
Winter,
Aye.
and Mayor McElvain.
Aye. Thank you.
Thank you.
That motion carries. Thank you, Director Beans. Okay, moving on to item number 11, council travel reports. Councilmember Schrader.
Oh. No, I don't,
Okay.
and seeable future.
Okay. I don't think Councilmember DeQuisto's on that list. Okay, so we'll move on to item number 12, suggestions from council members relative to potential topics for future city council meetings. Councilmember Schrader.
I would like to have someone provide us with an update on the progress of our downtown project. You know, I think that in the this current agenda, we had several items that might not be fully understood, why we're doing certain things with the funding that came through Block 7 or the previous funding, particularly related to addressing the needs of our businesses downtown and what efforts we are doing. And I'd like to have a report.
So just an update on overall what's happening downtown with construction and parking and buildings and when they'll be complete and cost and all that.
Yeah,
Correct?
and
Okay.
about, you know, like the questions I think we mostly get, and we've addressed it in 2 items in the agenda. One was extending 2-hour limits on parking on Oregon Street, and also changing the some curb and other things. But have that articulated better on how that's improving things, and what other things we need to be looking at, and how we're spending some of the project funds to improve, not just for the long term, but the short term.
Right, so I just want to make sure we do the right report. So shorter on what the future looks like, longer on the mitigations of current impacts.
Shorter on long term and longer on short term.
Gotcha.
Okay. Thank you. Anything else for the good of the order? Okay. Thank you. I'm going to adjourn that meeting, and we will now continue on to our special meeting.
Before you open that, can I say, girls, you were so patient out there.
Yeah, thank you to the handful of people that came tonight and observed the social distancing guidelines. We certainly appreciate that.
Thank you.
Okay, I'm going to call to order the special meeting of the Reading City Council, March 17th, 2020, listed for 6:05 p.m. If we could have roll call, please.
Councilmember DeQuisto,
Present.
Resner,
Present.
Schrader,
Here.
Winter, here, and Mayor McElvain.
Here, thank you. So we'll move on to item number 2, regular calendar. Under the mayor's item 2.A, consider adoption of resolution to declare state of emergency. This is something that the city manager and myself spent a great deal of time talking about, and we feel that it's the best move forward at this point. So I am going to turn it over to Mr. Tippin.
So I won't go into the issues relative to the coronavirus, since we had a lengthy presentation earlier. Essentially, that's what we're trying to respond to. The emergency declaration in front of you is for a local emergency. It falls in line with what the county did today at 5 o'clock. They not only did a state of local emergency, but also a public health emergency. So this falls in line with what they are doing, as well as what the city of Anderson is doing tonight. Essentially what this does is it provides us a better opportunity to be prepared. So there's not a significant amount that I would see happen in the immediate future. But it does provide us some flexibility in public contracting if we needed to react swiftly to, let's say, the construction of a MASH hospital unit in the convention center parking lot, or if we had to procure chlorine that became in short supply for water treatment and we needed to bypass some of our normal purchasing. It provides us opportunities to work effectively with Cal OES and FEMA, and to put all our accounting together for potential reimbursement of such things in the future. And lastly, it provides me some flexibility as directed by the council to work with staff to look at opportunities, if directed by public health or otherwise needed, to close city facilities, to change operating procedures, make appointments by appointment only, deal with sick leave issues, provide leave banks if necessary due to school outages or quarantines, or people who have compromised immune systems and or over 65. And so it just provides those tools to make sure that we're effectively responding to the emergency of the COVID-19. And with that, I will close my comments and ask for a 4/5 vote, which would provide the state of emergency as requested.
Okay.
I just had some questions.
Councilmember Winter?
Is that okay?
Oh, yeah, absolutely.
Okay. I just wanted to know, as part of this, with on the state of emergency, and if this would be the right place, we'll be able to post information on our own website on any state or federal mandates that are coming down quickly for the community? That would be, I have 3 questions, so that'd be one of them.
Yeah, so obviously that does not require the state of emergency to be issued. We have a fairly robust community input or output information page now. What it will do is it provides us an opportunity to perhaps access small business association or administration loans. So for instance, if they actually pass that and are offering small business loans, then our small businesses may be able to access that through the declaration. Now, we probably could have done that through the declaration of the county only. And so largely what this does is provide us extra tools administratively, but it does allow that.
Okay, and then, and so you addressed the small business. That was my other question, is being able to provide information, because things are happening so rapidly. And then my other question, I don't know if this would be part of it, is there, would it be okay to request, if the council would be okay to have staff come back with a potential report from RUI? I'm just concerned about the loss of commercial revenue with businesses closing, and how this could affect REU's budget. You know, when you have like the Civic is closing and the Cascade is closing and other businesses closing, that could have an impact on our commercial revenue. I don't know if there's a way to predict that, but it'd be nice to come back with a report.
If council likes that, we certainly could do our best. So for instance, we have historical usage. You know, we can make some estimations on what happens with a 1 month, 2 month, 3 month type of closures on certain facilities. At the same time, maybe we're having increased usage at the hospitals and other locations. And so we could certainly do our best in terms of identifying the large users and seeing what their usage patterns are and the differences, and bring that back. We have to update this emergency every 2 weeks.
Okay.
And every 14 days with a report, so that would be an opportune time for us to bring back at least what we're seeing on that basis.
Okay, Councilmember DeQuisto.
Thank you. Mr. Tippin, when they had the government shutdown, the federal government, they talked about essential employees and non-essential employees. My question is, does the city have employees categorized in that fashion? And if so, has any consideration been made to non-essential employees for their health and safety and benefit, to saying don't come into work?
Yeah, the answer to that is yes. We've talked about this at length at the department director level, and tomorrow morning, based on the issuance of this, if the council approves it, letter will go to all of the department directors directing them to identify all staff that are eligible for telecommuting, those that are essential for operations of the water treatment plants, power plant, obviously public safety, police, fire, and also looking at it from the standpoint of if we're going to close the city, are we going to close it down in terms of business? If we keep it open for business, how do we have it staffed for appointment only? For instance, some commercial activity continues, we still need to do inspections, issue permits, and so all of that is being identified not only from a standpoint of essential staff, but also from the standpoint of allowing people to work from home as much as possible, and also providing flexibility to those who feel like they're compromised or have children, and providing them the ability, as was mentioned by Dr. Ramstrom, that make them encourage them to actually stay at home as opposed to coming to work because they have less sick leave or because they don't want to use their sick leave. We want to encourage them to stay home as well. So, yeah, we're doing our best to meet all of those marks as you ask.
The other related question is related to what Ms. Winter said. If the business is shut down for 15 days or 30 days, it's going to be a huge impact to the TOT and the sales tax, and it may continue for a while. So would it be safe to say that in the next meeting in 2 weeks when it comes up again, you'll have some estimates or forecasts if we don't get TOT for 3 months, how it would affect the budget, if we don't get sales tax, or if we get it at 5 or 10 or 15%, those will be provided to us?
It's a little different than our actual ability to project probably within the next 2 weeks. What we've done to this point is we've modeled scenarios of drops in sales tax of X amount, like if it's flattened or if we're minus 3% over the next 6 months. We've run those scenarios to date with our 10-year plan. Within the next 2 weeks, it's probably too early to determine whether we're going to have actual dips in those other than what we just would guess, because the reporting on that is on a quarterly basis, and so we get that information in later. So what we could do within the 2 week period of time is just give you ideas of what certain levels of reduction equals in terms of impacts on the general fund in particular.
That's fine, and as more time goes by, then the estimates or projections could be more specific.
Absolutely. As we hit each quarter, we'll know what we're going to hit. So, for instance, in the quarter that we're in, we actually think sales tax is going to be up because of all of the purchases that people are making to prepare. But after that, we expect those to go down. But keep in mind, we've also been running high on our sales tax, largely driven by extra expenditures maybe for the construction industry. If that construction industry stays robust during this period of time, it could be that consumer spending will not be as bad in terms of making us go downwards on our revenue projections. And so, but as we hit the quarters, we'll definitely have a lot better information. And on a monthly basis, we get TOT. And so we'll have a much better month-to-month basis on our TOT, but we'll certainly keep the council well informed of how our budgets are looking.
Well, I was going to say, I listened to the president today and his meeting with some of the Hilton and Marriott and Hyatt and those kind of people, and they're talking about occupancy rates of 10%. So the TOT could be a very significant issue. Hopefully it won't be, but if you get those on a monthly basis and you can provide those, that would be greatly appreciated.
Yeah, well, we may actually, instead of doing quarterly, up that reporting back to the council on a more monthly basis, or as needed as we see those trends develop.
Thank you.
Thank you, Councilmember Schrader.
I want to share my appreciation for that we're doing this, and I too had the question that Councilmember Winter already brought up about how this will enable our small businesses to have access to potentially small business administration financial help. So I'm appreciative of that. Want to make sure that we provide that information out publicly so that those questions can be answered for any businesses that might be wondering if this will help them. Oh, and I'll make a motion that we adopt the resolution.
I have a motion. Is there a second?
I'll second.
Okay, she's got it.
All right. We have a motion and a second. Are there any other questions? Okay, if we could have a roll call vote, please.
Councilmember DeQuisto,
Aye.
Resner,
Aye.
Schrader,
Aye.
Winter,
Aye.
and Mayor McElvain.
Aye. Thank you, everyone. And with that conclusion, I will adjourn the meeting.